Hi there. In honor of my employee who had a baby yesterday, I am going to tell you some of the instructions that I give my new parents, and I'm just going to put it down as a quick video for a change. First of all, if you just had a new baby, congratulations. It's a wonderful thing. A wonderful thing. So let's start at the top. The baby's scalp is going to be scaly. And if you use your nail and try to scratch off the waxy stuff, it's normal that's going to be there. That's what was often called cradle cap or whatever. Once the belly button falls off, the umbilical cord, you're going to wash the baby's hair every day, and that cradle cap will gradually go away. Do not put oil on it. Oil is what makes the cradle cap worse. And so you see a lot of babies have thick cradle caps when they're 3, 4 weeks old because they've been getting Johnson's baby oil or whatever stuck on their head, and it just makes it worse. Washing the baby's hair will naturally get rid of that. A lot of parents think that the baby's got dandruff and they need to put oil to make it not look so bad, whatever. But when the cradle cap gets really bad, we call it seborrhea dermatitis. And then you start to see that the baby has baby acne as well because all the pores are getting clogged up with all that extra oil. And speaking of oil, try not to put perfumed things on the baby. You try not to expose the baby to all those nice smelling, sweet, baby smelling stuff until later. The later you put it off, the better. When you expose a baby to all those perfumes early, they're more likely to develop allergies later on. Babies are not flowers. We love them. They look like flowers, but they're not. Do not water the babies. Do not give babies water until they're at least 2 months old. That might sound strange, but if you understand that the baby's blood volume is like 2 tablespoons, and now you come with a whole bunch of water and you dilute it, you can cause water on the brain and then the baby can get seizures. The other thing is if you fill the baby up with water, there's no room for food. The baby gets enough water through the breast milk, and if the baby's taking formula, well, you put the formula in the water, so you know that there's plenty of water in there. So the baby gets more than enough water. Do not water the babies. The smaller the baby, the more water can be harmful. Hiccups. I'm sure mom felt the baby having hiccups on the inside. Well, guess what? They have hiccups on the outside too. And the hiccups tend to worry the parents, more than it worries the baby. The baby doesn't care. Baby's hicking away, and the parents are worrying about what should we do? Give the baby water? No. Should we do this? In some places, they put a piece of white cotton or red cotton, depending on the culture. It doesn't matter. It doesn't bother the baby. Think of it as the diaphragm is growing and expanding, and it hicks every now and then. So it's just the baby growing. Let's look at the skin. Babies are like snakes. You didn't hear it from me. But that first layer of skin is going to be shed. So you don't need to be picking and scratching, and don't worry about it. They're going to be scaly and dry. And then after that first skin comes off, the baby's going to have that beautiful baby skin that you see on all the commercials and that you remember from your babies. If the baby develops white on the tongue, that could be thrush. It's not overly harmful, but if it gets to be too thick, it can affect the baby feeding. And if you've ever had thrush in your mouth, you know it's not comfortable. It can affect how the baby swallows. One way to help prevent thrush, because thrush is just yeast, basically, and there's yeast in a mother's vagina. So obviously, babies that come through the vagina are more likely to have thrush. Babies that are breastfed are more likely to have thrush. But if mom takes probiotics, the good bacteria compete with the yeast, and then there's less thrush. So that's one way that you can prevent thrush in your baby. And then when you go for your visit, if the doctor says the baby has thrush in the mouth, don't panic. It's very easy to treat. You'll get a prescription, and that's all you need to do. Let's talk about baby snuffles. That's what I call them. So you will notice that babies snuffle a lot. And the reason is the the hole at the top of the nares in the nose is like a pin. It's like a pinhead. It's so small. So all it takes is a little bit of mucus to clog it up. And then you can't take it out. You can't get up in there, and you should not get up in there. So the only thing the baby can do is sneeze. And the baby sneezes and gets rid of that mucus. There are other ways you can help. You can use the saline, just pump the saline where it sprays up the nose, and then the blue bulb that you get from the hospital, you put it right on the edge. Do not put it in the nose. That will traumatize it. It's much bigger than the baby's nose. But you can put it down here and try to create some suction and pull that out. You can also take a Q-tip and wet it and stick it right on the corner. And if you're lucky, you twist it and it'll pull out the whole booger. Otherwise, you just have to wait until the baby sneezes and it'll come out. So oftentimes, 3 days into having the baby, I get a call. I think the baby's got a cold. Snuffling, sneezing, baby has a cold. No, the baby doesn't have a cold. The baby has snuffles, which are normal. If you want to cut your baby's fingernails, you don't use a nail clipper until they're much bigger. But what you can do is you take your nails and you pick, the nails are so soft, you just pull it and they come right off. You catch it at the edge and pull it. I do not recommend using nail clippers because you can damage the baby's nails. They're so little, even when they're those cute little baby clippers. Try to just stay away from them. If you think the baby has a chest infection or pneumonia, if the baby's nose is not going in and out, which is a sign of respiratory distress, or you see the ribs going in and out with each breath, that's a sign of respiratory distress. But if the baby's breathing normally and just snuffling, let them snuffle. So let's talk about poop, because when you first leave the hospital, the baby will poop after every meal. But that slows down pretty quickly in the first week. And then all of a sudden, you'll be like, oh, did the baby poop today? Must be constipated. No, it's natural. The number of poops slows down. When you come out of the hospital, initially it's a different kind of color, more yellow, but as the days go on, it gets a little browner. But unless the baby is struggling and churning and little tummy is popped out and looks uncomfortable, probably not is not constipated. So if you wait a little bit, the baby will poop. Do not give water. If it's a male, then the circumcision. If you chose to get the baby circumcised, you don't need to do anything with it. So I know that you're in the hospital and the nurses tell you that you've got to put this ointment and this gauze and take this off and change it every time you change the baby. You've already traumatized him with the circumcision. Why do you need to traumatize him every time you change his diaper? You don't. The circumcision is going to heal up on its own. You put your finger in a jar of Vaseline, you got a glob of that, you put it around the little pee-pee, and you put the diaper back on and you keep moving. There's no need to go through all these conniptions that I see people doing with the circumcision. And that's why the baby is crying every time you change the diaper. It's not comfortable. Fortunately, circumcisions are getting less and less. The umbilical cord. The umbilicus is the part that connected the baby to the mother. And that's where all the food and everything came through. The rest of the baby was not connected physically to the mother, except for being in there. The baby comes out, they cut the cord, and now you have this piece of meat hanging off the umbilicus. That is a dead piece of meat. So if you're going to stick your nose down in there, it's going to smell bad. So if you go, oh, I think this is infected, it's not infected. The only umbilici that get infected are the ones where the mothers mess with them. The umbilical care, all you have to do is wipe the outside around the umbilicus, the part that you can see. Never try opening the umbilicus and say, I got to get in there and clean it up. No, you should not do that. You leave it alone. You only clean the part that you can see. And if you put your nose down there, like I said, it's going to smell bad because it's a piece of dead meat. And it will fall off and it will close up nicely on its own if you don't bother it. That's a quick video about some of my tips for newborns. And if I think of some more, I'll make another video. But today I just said, why don't I just do a video? And then I don't have to keep repeating this list of instructions. Nice to see you all. Take care and congratulations on the new one.